And
hello everyone, and welcome to another episode at the intersection of science and society. This evening we'll be speaking about HIV and AIDS, how it's affecting the world, and how it affects each and every one of us. Pardon. Okay, Miguel, can we go ahead and get started?
yes, thank you, Rando. And go ahead and introduce everybody else on our panel. We got Roy. Want to say hello?
Hey everyone.
And we got Sergio.
How's it going?
And Summer.
Hi everyone.
And we welcome you to another segment of Beta Sheep. And my name is Miguel. And this is episode 4. And today we will be covering HIV.
If I may interject, I'd also like to note that Paul wanted to be with us tonight, but due to some technical difficulties, he's not able to participate. We miss him. We wish he was here. So, okay, Miguel, keep on going.
Noted. Now, before we get to our topic, I wanted to do I want to recap on last week's topic of Ebola. And as of July 15th, the Boston Globe was reporting that we had around 539 deaths in Guinea, Liberia, and Sierra Leone. And, of course, that had been attributed to the Ebola virus, like we covered last week, and it's the largest outbreak on record. Is that number still accurate, Sergio?
So we're standing at 982 total cases and 613 deaths.
Oh, wow, the number has definitely jumped up over the past 2 days, so, yeah.
And that was as of July 14th.
Noted. All right. Let's see. So this week, like I said, we're talking about HIV, and we're going to take some of the trending topics about HIV. HIV stands for the human immunodeficiency disease, which causes AIDS. AIDS is also known as the autoimmunodeficiency syndrome. One of the leading news trends for HIV has, of course, been the Mississippi baby. Did y'all read anything about this, guys?
I did not.
He got cured.
So with the Mississippi,
Last I heard was that they actually found detectable levels of the virus in the baby again.
Yep.
Yes.
correct. So yeah, one of the leading news trends was that HIV had been they found it in the Mississippi baby. And what the Mississippi baby was is in 2010, a little girl was born to an HIV-1 infected mother who was unaware of her HIV status and did not receive the aggressive prenatal treatment that is usually given. So, given these circumstances, a pediatric HIV specialist at the University of Mississippi Medical Center in Jackson decided to...
Hello?
I've been talking to myself this whole time. I need a restart.
What?
He had his mic on mute.
I apologize for that, guys. Okay.
Should we try this from the beginning?
Oy vey.
Oh, classic Miguel. I'm like over here talking like, what do you think, guys? I'm just like, oh yeah, my microphone's on mute.
Well, let's start over.
I'll just start talking from the beginning.
Now let's redo the whole thing.
Right.
Take one.
Take one. All right, guys. This week we are talking. Wait, just from the article, right?
Oh, I meant start. That's just me. I kind of like the intro.
Yeah, we should probably do the intro again.
And I'm gonna rewind this. We're starting this bad boy, guys. All right.
All right, hello everyone. Welcome to another episode of Beta Sheep at the intersection of science and society. This week we'll be speaking about HIV and AIDS and how it affects the world, how it affects us, and the biological factors behind it. Okay, Miguel, would you like to get started?
Yes, thank you, Randall. As Randall pointed out, my name is Miguel, and some of the other people that will be joining us on the panel. We have we have Roy.
Hello. Hello.
And we have Sergio.
Howdy.
And Summer.
Hi.
And we welcome everyone that is, the small audience that seems to be following us. And we appreciate the views on YouTube. And we welcome
Thank you, every one of you.
We welcome you to another episode of Beta Sheep. This is episode 4. We are making way, and today we will be covering HIV. Today on our... I'm sorry.
If I may interject, small note, Paul, who has turned into a regular contributor to this podcast, is having some technical difficulties this evening and won't be able to participate with us. Paul, you will be missed.
Paul, you're in our hearts and here in spirit.
Miguel, do you want to cover what we covered last year?
Yeah. Last week, yeah, exactly. So before we get to our topic, I wanted to recap on last week's topic of Ebola. And when I was reading out of the Boston Globe on the 15th of this month, and it was reporting about 539 deaths in Guinea, Liberia, Sierra Leone. And of course, this is attributed to the Ebola virus, and we are experiencing one of the largest outbreaks on record. How accurate is that figure, Sergio?
As of July 14th, we're looking at some additional deaths, so it brings the total to 613.
Wow, 613. That is getting up there. How many infections total?
982 is what the WHO is reporting.
And I think last week we saw that they were estimating about 1,500, so it definitely seems to be climbing that way. And let's see, we're going to jump into the topic. This week, like I mentioned before, we're going to be talking about HIV. Now, HIV stands for the Human Immunodeficiency Disease, which leads to AIDS, also known as Autoimmunodeficiency Syndrome. And just want to make sure my microphone is on, guys, right?
Yep.
Right. One of the leading news trends, of course, that has been brought up is about the Mississippi baby. Have you guys heard about the Mississippi baby? It was first introduced into the media probably around 2010.
Yep.
Right. Yes. Okay. So for those of y'all that don't know what the HIV, I'm sorry, what the Mississippi baby was, it's this baby was born to an HIV-1 infected mother who was unaware that she had HIV. And most of the time, when mothers are aware that they have HIV, there's a aggressive prenatal treatment that is given in order to prevent the baby from prevent the transmission of HIV to the child. In this case, that did not occur, and so a pediatric HIV specialist out of the University of Mississippi Medical Center in Jackson decided to act quickly and treat the baby with 3 different antiretroviral drugs. So it says like at 13 hours of birth, detectable levels of HIV were found in the baby, confirming that the baby was HIV positive. And then 29 days later, we found that the virus fell below the detectable limits. And of course, right before the child's 4th birthday, which is one of the trending articles that has came out this week or in this past month, we see that the T cells had started to dip, and which later they did further tests and they confirmed that the baby was actually positive for HIV. So the Mississippi baby was a no-go. Today, from my understanding, I don't think there's any patient to have been cured of HIV. Is that correct?
I'm not sure.
Define cure.
Cured,
Like free virus free.
I guess by cure, what I'm saying is is it a drug that's been given to a child that totally cures them and basically removes HIV from the system?
No, what has been attempted is that people have undergone chemotherapy, cancer patients that are also HIV positive, and they'll do a bone marrow transplant in effect to wipe out all of the cells that carry HIV, but even this has not shown success.
One thing interesting, I saw that this patient, he's known as the Berlin patient, Timothy Brown, and it says here that he was being treated for leukemia, and he had his bone marrow removed, then replaced with a donor's bone marrow, which contained a mutation where the CD4 T cells lacked a certain receptor. And from my understanding, this receptor is what's utilized by HIV.
One of them, we believe, yeah.
All right, all right. And from here, I didn't put up on the screenshot here. Oh, I got the screenshot going right here of the beta sheet. And so we turn to our virus expert, Sergio. And maybe you can fill us in on some other information about HIV.
So HIV stands for the human immunodeficiency virus, typically a retrovirus. So the reason that ugly virus is because it attacks basically your immune cells, and it'll lay dormant, and under certain stressful conditions can basically bud out and induce AIDS. So basically deplete your immune system cells, which leaves you vulnerable to infection of other opportunistic pathogens. And it's lifelong, basically, because you always have immune system cells, and so they're always infected. So it's a really unfortunate, very specific tropism of the virus to target your cells.
What are some of the symptoms associated with an HIV infection?
Depends on what stage the virus is replicating in the humans. Specifically, it has two stages. One, it can integrate in your DNA, into your cell's DNA, and you don't really see signs and symptoms then. But when the virus is budding out and destroying your immune cells, you often have, people describe it as a really, really bad flu. So malaise, fever, swollen glands, sore throat, rash, fatigue, muscle and joint pains, and a severe headache. That's usually when you see it replicating.
Nice. Now, Sergio, from my understanding, this mode of transmission has brought some concern to the dental patients in Victoria.
Victoria, yeah, in Australia, correct. Just the nature of dentists and healthcare workers, a lot of different infectious agents can be transmitted, especially, in the dental situation, you have direct access to patient's mucosa, you have spit, saliva, potentially blood when you're cleaning the gums, so that's really easy to transmit a pathogen, a bloodborne pathogen like hepatitis, HIV, tuberculosis, and syphilis. So, yep, definitely a big concern. You don't want to go to the dentist sick.
That sounds pretty dangerous. Now,
if I may interject, actually, it was about last year or 2 years ago. There was a case here in the States where there was a dentist who did absolutely poor hygiene with all his instruments, and he actually passed hepatitis C and various other bloodborne diseases to many of his patients.
Correct.
So it's just to show that it can happen anywhere. There's no proper hygiene or no proper sterilization techniques taking place. Now, I think you're probably referring to patient to provider transmission, though, right?
Correct. Mm-hmm.
Okay, I just wanted to make a note that even if all the providers take all the precautions for themselves, that they can still pass it between patient to patient if they don't actually take care of their tools.
Right, exactly. They're putting the same tools in everybody's mouth, and if you don't sterilize them, you pass exactly what the other person had. Just like a big STD.
Noted. So clean it off before you put it in your mouth. Let's see. We don't have Paul with us,
tools.
And he was our panel expert for preventative obstacles. But from my understanding of this, we know HIV causes AIDS and damages the body by destroying immune cells. And some of the other factors that might play into this would be reservoir cells. Sergio, maybe you can elaborate more on what it means for, the dormancy of HIV within certain T cells, or maybe just certain infected cells that doesn't necessarily seem to be showing. Because I feel like this is one of the cases, or this was the case for the Mississippi baby, where those HIV wasn't being detected because it was in a dormant stage in these reservoir cells.
Right, and so, the specific immune cells that you're targeting are the main players. So your macrophages, your dendritic cells, basically the things that gobble up other bad things in your body, along with T cells, which are necessary to potentiate your immune system for a really long time. So what will happen is the virus will integrate its own genetic code into yours. And when it does that, it's exactly you. It becomes a part of you, and your body cannot distinguish whether you're infected or not. And so that's that whole latency phase where it's dormant. And so you really have no idea. Your body has no idea that you actually have the virus.
Noted, noted, noted. Now, Summer, as part of our culture expert on the panel with the HIV prevention recommendations, what recommendations have you seen put out by the WHO, the WHO organization, and what are maybe some of these leading medications that are being used to prevent the transmission of HIV?
Right now, the WHO is recommending the people who are, or especially men who are having sex with men, that they take the antiretroviral pills to prevent HIV infections. And in addition to using condoms, it has been estimated to cut the HIV incidence among these people by 20 to 25%.
Isn't the AIDS Foundation actually, or AIDS activists actually against this drug?
Uh,
I think it's with the underlying tone that basically people think or assume that taking the drug will make it safe for them to have sex with other HIV infected patients. Then you run the risk of you have more people having sex, and then you have people that might forget the drug and therefore passing on the infection. So it becoming actually increasing the amount or increasing the chances of the transmission of AIDS.
right. As one doctor was saying, people who are choosing to take the drugs might not be using the condoms as well. And then those people who are not using condoms, they just intend, or they might run incidents where they forget the pill or not using protection at all.
And what's the name of the drug?
It's called PrEP. PREP.
What does PrEP stand for?
I don't remember. Let me look it up.
I feel like it's like a it's basically like being on the pill, like girls get on the pill, but this is for gay men basically to not pass on the transmission of HIV.
Well, can't anybody take it though? I mean,
Yeah. There's ART, which antiretroviral therapy basically. So it targets specific proteins of the virus that are unique to the virus basically.
yeah, I just don't want it to seem like a targeted thing.
Well, I mean, if you have a high risk, it's like taking, I don't know, just a pill to mitigate high risk.
No, I understand. What I'm referring to are the social context in the way you could describe it. You know what I mean?
Yeah, it is a sticky situation because this is a very polarizing aspect of how it applies to society, because it's a societal driven disease in many aspects.
Yep.
All right, it's a sticky situation. Let's see, and moving on, we want to look at the healthcare policy and HIV treatment, and we have Randall, our law policy expert.
Oh yeah.
How has the implementation of Obamacare affected HIV patients in terms of co-pays for medication?
Let me tell you something about Obamacare, and then we should have like a American Eagle, like bald eagle, like just in the background. What we're looking at with the implementation of Obamacare, or to go by its real name, its formal name, PAPACA, as I like to call it, is providing coverage to individuals, especially those with pre-existing conditions, that the insurance industry is considering pretty onerous to their bottom line, and as a result, they are upping the cost to pay for these drugs for those who, say, have a pre-existing condition or may be targeted in some other way related to the HIV, whereas any other individual under a different plan that may not be within the scope of Obamacare, or, I don't know, say it's covered under Medicare or something like that. I don't know too many details about this, so I may be beyond my element here as far as my understanding is concerned, so please bear with me in that regard. But when you look at a price that somebody, say, gets under Medicare, Medicaid, $25 for PREP, or I forget the name, Truvalis or something like that, I forget the name that they use for it, versus someone who's under an Obamacare plan, a PPACA plan, where they're having to pay $1,000 for the same kind of prescription, and they have to keep paying that up to that 6,000 and such, 6,000 and change limit that is set by PPACA. You really see a sort of huge discrepancy as far as pricing is concerned for those individuals who, in a sense, are targeted by a pre-existing condition or otherwise, and would need those kinds of drugs, would need ARTs.
Noted.
So,
Noted. So yeah, do you feel like people with HIV are, I mean, is it basically making it more affordable for them? Do you feel like people with HIV that, you know, have been infected with HIV are able to seek the treatment that they need under, I'm sorry, I don't want to call it Obamacare because I don't want to upset you. What you're saying? The affordable
Healthcare.
the Affordable Care Act, we'll just call it that.
Affordable Care Act, ACA, noted. Yeah. So, is it more effective for them, or is private insurance, I guess, still the best way to go if you have an HIV infection?
I would say neither, and then I would make a long rant about single-payer insurance, universal health care, et cetera, et cetera. But frankly, if you're going to have this kind of a setup for people, there should at least be some kind of provision within the law that doesn't allow for such a, I want to use the word discrimination, but that's, I think, kind of a strong word in this sense. But it is the targeting of drugs for specific individuals who have these conditions, pre-existing or after the fact, and how it affects them versus someone who, say, has a non-Affordable Care Act plan and is allowed a much lower copay for their prescriptions. It seems genuinely unfair. It seems ridiculously out of proportion. So, but in that context, you know, we, as far as the law right now is concerned, you can't really change how it's defined. Now, perhaps they can, I know they're trying to make a case out of calling it a civil rights violation, which may be true. I don't know all the merits of what's going on, so I can't say yes or no either way. But certainly under current law, with the way the system is set up now, it's not exactly like you're going to see this change from private industry beyond, I don't know, a very large outcry from the population, or some sort of civil rights violation that gets litigated and taken to its conclusion. And you're going to keep seeing plans like this because maybe in that sense it does affect their bottom line. I mean, you know, they are constrained by regulatory concerns through the Affordable Care Act, and they're going to adjust their prices accordingly.
Noted.
I do want to interject real quick. It's one thing that, because of the Affordable Care Act, many people who have pre-existing conditions such as having the HIV virus or actually having AIDS, they can get covered because of the Affordable Care Act. Without that, insurance companies would say, no, we're not going to insure you. So those people would have to pay for all the medication out of pocket, all the treatments out of pocket, or if they got lucky enough for hospitals to give it to them pro bono, or if they were poor enough that they could go to Medicaid, Medicare. But because of the Affordable Care Act, they're at least able to get some help. Insurance companies are forced to accept them into their plans. Granted, those plans are very expensive, but when you're talking about the medications for AIDS, where they can cost thousands upon thousands of dollars, I'm not talking about thousands, I'm talking about tens of thousands, if not maybe up to 100,000, and your cap's only $6,000. That's a great deal.
Oh no, I agree. Don't get me wrong. I'm not. I guess I'm just doing or trying to provide a devil's advocate view of this entire thing from the point of view of those with all the money. And in that sense, you see that as far as their bottom line's concerned, and the way that they as corporate individuals, let's say, or they as collective entities, having lost one gravy train, having to go onto a probably slightly less profitable gravy train, you certainly are going to see how they're going to react accordingly and make this kind of a onerous burden on those who, yeah, it's true, it's great that they cover pre-existing conditions, but I mean, it's bad that they have to pay so much out of pocket for something like this when you can't put a price on this kind of situation. You can't put a price on health. You can't put a price on life. So,
I completely agree.
And nonetheless, like I totally agree that while it is more expensive than maybe other plans would be, it brings down the cost tremendously. Moving on to looking at community health services, I want to talk to you, Roy, about how are some ways that screening for patients might be or have become more effective?
Well, the CDC is actually running a couple of trial programs, and essentially just boils down to make it into routine testing. When patients come in for, oh, they're sick because of this, have an actual HIV test become a routine test, where it's tested all the time for every person who comes in for any type of disease. And in this case, they've actually been able to find more HIV prevalent people that had no idea that they were HIV positive. So they were able to start medications to actually help them control this disease. So the biggest thing here is they need to know that they have it. And if it's not a routine test, people will not be able to know if they have it.
That's probably heavily influenced also by maybe some culture issues that might come about of people not wanting to go to the doctor or might be holding off and not wanting the full screening process. It's only doing them a disservice by not knowing the full scale or everything that might be wrong with them.
Oh, granted, I know plenty of people who they don't want to know the full story, like you said, and it's sometimes a cultural thing. Sometimes it's a cultural thing. It just depends how you grew up, how you feel about it, and it can also be how, essentially, like you said, culture, if they want to know or they don't want to know. But the CDC is trying to push out more of to inform the public of, hey, this is what you have, this is what can be done, this is how to help you. But if they don't know, they can't do it.
Noted. No, I don't mean to pull back to you, Sergio, but do you think and maybe this goes to everybody on the panel, do you think we'll ever find a cure for HIV? And by cure, I mean a drug that you basically take, a magic pill, and it basically eradicates HIV from your body, eventually eradicating the disease maybe altogether.
Honestly, I don't. From a virology standpoint, I don't honestly see that happening, just because the way it integrates into your actual code. We don't have a drug per se that will actually target specific sequences of HIV DNA once inside you, and so I don't see a drug on the horizon that would be able to cure AIDS or cure HIV. I mean, we have drugs that can suppress HIV, but not cure it. Honestly, another virus would be the one that did it. That's the only thing, gene therapy that I can think of that would be working.
I, on the other hand, think that it's going to be more it's not going to be a drug so much as a change in the way we deal with HIV. As you said, when a mother is found out to be HIV positive and she's pregnant, they're very aggressive with medications they give her in the prenatal treatments to stop AIDS from spreading to their child. And if you see everyone or the population take that sort of stance as a whole, you'll see HIV prevalence to drop down. I don't think we'll ever see it disappear, but we'll be able to make it much less of a threat just through instructions on how to deal with it. I mean, if you have it, there's things that you can do, things that you can't do, and hopefully you follow what you're supposed to do or you do what's recommended. And it'll help bring down the prevalence of it and stop the spread.
Are we going around for this type of thing, or?
Randall,
might as well.
if you have any input, definitely feel free to jump in. But yeah, it's not required, my friend.
Yeah, I don't. I don't think we're going to see something in our lifetime. Uh, the only thing that I'm no scientist. I'm not Sergio. I don't know how this kind of thing will change. How we're going to see the development of what we could say is prevention, control, and cure in our future, be it through biological means, a manufactured, engineered means, um, something like that. But I mean, I really feel like, especially for something like this, which is a really huge concern, it really does affect everybody. But in the popular consciousness is something that, oh, it's something that they have. I'm never going to get that, especially if you're a member of the mainstream community. I don't know, the heteronormative community, whatever term you want to use to describe it. You're really going to think out of sight, out of mind. Oh, that's a concern. Oh, I'm going to go buy a product that gives $10 to it or whatever. But beyond that, that's it. I feel like you're going to see some diminishing returns because it's not something that, popularly speaking, is going to be prevalent in everyone's mind. It's not like cancer. It's not like Alzheimer's, which is now becoming more and more prevalent as far as popular consciousness is concerned. And for that alone, for the lack of awareness alone, you're not going to see the attention that this really does deserve in order to help fund it, help fund research to find out more about it, help fund ways to better control it, help fund anything that would help to alleviate this problem without some kind of serious change as far as society and culture is concerned, as well as some more active support from the government in order to to really further whatever research and preventative goals we want to pursue in that regard.
Right, right. Overall, it seems to be a combination of not only as we make progression within science advances, but also a cultural policy and behavioral changes that it's going to be a combination of all of those that I think lead to maybe not the eradication of HIV, but definitely a way of bringing it down in the numbers of infections of the people that it's affecting.
Yep.
Right.
That's good.
What else we got about HIV, guys? I mean, we hit most of the trending topics going on right now.
Yep.
I remember reading or seeing a graph, and this is granted maybe 10 years ago, so I don't know how much has changed. But if I remember correctly, upon initial infection of the person, the actual number of cells of white blood cells or the immune system actually increases during the first couple years or the first year. Now, does that still hold true? And if it does, would that, just theoretically speaking, would that be like a perfect time or a good time to be able to actually maybe not eradicate but suppress the HIV virus before it actually starts killing off all the immune system? I guess it's a question more for Sergio.
But it's really just going to depend how many cells are infected, because it only needs a few cells to last. And that's why people never get full-blown AIDS, is because HIV will never bud from these cells, or in very low amounts. And it's kind of a crapshoot, to tell you the truth, in terms of we don't understand what causes a lot of the release to go to full-blown AIDS, and then how to counteract that. It's difficult, but from a virus perspective, yeah, it would be very beneficial to have an increase in the number of cells you need to spread. And I would take a guess to say that you have this virus that comes in, your body will recognize a virus to a certain extent, an actual infection. That's why some people do get sick 2 to 4 weeks after HIV is transmitted to them. They do develop like a flu-like illness, like I talked about earlier. And that's because your body's responding to a viral infection and fighting it off. But all it takes is for 1 or 2 viruses to actually go into a cell and then go dormant. So, kind of sucks.
Noted. Moving on. It concludes our HIV section of the segment. We really had reserved towards the end just like a little random Q&A session, but I didn't really prepare any random questions. The random question I did have prepared, Sergio disliked it, so.
So you know what? Go. Just roll the dice.
Well, Sergio, you wanted to talk about the origin of the word vaccine. You want to elaborate on that?
There was just a question I wanted to pose to the group. Does anybody know where vaccination comes from? Vaccine?
The word?
Yeah.
Based on my Latin studies, I would say vaccinus.
I want to say that it's Italian because you got 2 C's, so you got the vaccino, and from vaccino, which was a term from Italy that was referring to preventative care, it turned into vaccine.
I also see VAC meaning, VAC you probably get vodka.
Yep.
So
It's a
I remember.
cowpox.
Sergio, have you heard of this doctor? He's pretty famous. His name is Dr. Mario. I think he helped popularize the use of the word vaccino into a vaccine into the English language today. With his groundbreaking work when it came to
Smash Brothers. God, that guy was
So
awful.
vodka means cow?
Yep.
It has to do with the cowpox, how they used it to help vaccinate for smallpox at the time.
You guys got it. You guys are so smart. Or good at Googling. One of the two.
I remember
It's
reading
probably a
about
combination of both.
a smart Googler.
A smart Googler.
Let me see. In other news, apparently, smelling your farts can make you live forever.
Not really. Prevents cancer.
Right. So there's 2 parts to this that I wanted to point out, and part of it is how stuff is reported in the lab setting and how things are actually reported in the media setting. And so the news article in Time and also on Gawker I read is basically smelling your own farts will help you live forever. And even Time elaborated, now you can thank that smelly guy in the elevator. And Time even classified this as the ridiculous study of the day. But falling back on the actual article, I went and looked it up, and this guy from the University of Exeter. Have y'all heard of that? That was the first time I read about it.
Yeah, I had a friend
We have a friend that goes there.
Okay, so the researchers created a molecule, AP39, which I'm assuming means it's an apoprotein. I don't know, Sergio. Maybe you can apoprotein. Maybe no. I don't know.
Maybe it's a fat transporting protein. That's what I would guess.
And what this protein does, or AP39, it delivers H2S, hydrogen sulfide, to the mitochondria, which helps preserve the cell. And for those of you who don't know, hydrogen sulfide is also what you smell, or what makes your fart smell. But there was no indication of the H2S coming from an exterior source, so it's pretty dumb. It's junk science, or it got turned into junk science. If I feel like the way that Time and Gawker reported it.
Yo.
I thought you were supposed to avoid that smell because it's harmful to your body. That's what
Hydrogen sulfide is harmful.
I know they definitely have certain requirements, like these guys that are working out in the oil fields and fracking companies, and they wear the H2S meters, and when those things start beeping, they just start running like crazy.
Yeah.
Any other random articles you guys came across?
Came across where somebody found this giant hole in Israel, in the middle of Israel. Don't remember where I saw this, but
What random hole? Where does it go to?
Israel or Siberia?
we don't know. The giant hole, we don't know who created it, how it was created, and
Aliens.
aliens.
Likely.
Drug cartels from Mexico.
They are ingenious.
All the bombings there.
Almonds?
I thought the hole was in Siberia.
Oh, never mind. Siberia.
Someone Google it.
Now, is it possible that
I just
HIV was engineered by the government as a way of controlling populations?
HIV? HIV?
Wow.
Unlikely. They found I actually just was taught by a dude who was doing, back in his early graduate school days, he was doing sections of histopathology from basically people that had died in like the 30s and the 40s. And so this is like immortalized human spleen, tissue, all sorts of crazy stuff. And so they're going back now, present day, 2010 I think was the most recent article, and actually staining for different viruses. And they found HIV. And this was from samples dating back to like 1918 and things like that. So it's been around for a really long time. So I highly doubt it's a government engineered thing, since it's been around
Noted,
since.
noted. That's just some late night reading on the conspiracy boards. I apologize.
Of course. Close the door on that.
And that sounds means it's time to go.
All right, and I want to thank everybody. This was an awesome segment on HIV, and I think we covered the main points of the disease, and we actually got to overview of the trending articles that are currently in place. You know, it's sad to hear about the Mississippi baby. I think it's definitely some well-intended excitement when they first thought that they had cured this child of HIV, and then just premature at the time. However, we continue on, and we will rebuild.
Yep.
Any last comments, guys? No? Sorry.
Thanks for watching, everyone.
It's always a blast doing these.
You guys, I think we all need a cup of coffee before we do this next time.
Cup of coffee. I need a beer, but yeah, otherwise I agree.
I could use a beer.
I can't. I have to sleep.
Okay.
Summer has to sleep.
Summer has to sleep, everyone, so good night, Internet.
Good night.
Look. Mysterious giant hole in Siberia.
Are you reading?
He's introing us out. Extra.
All right, everybody. Thank you for joining us for this episode of Beta Sheep at the intersection of the science and society. See you next time. Bye.
Oh yeah.
Are we still